Good. Let us have another discussion today, and the discussion today is about the drugs working and the autonomic nervous system. And the autonomic nervous system, you are going to work on the drugs which behaves like cholinergics. You remember that the previous lecture we talked about anticholinergics. Now let us reverse this discussion again and talk about cholinergics. Agonists, these are the drugs which behaves like acetylcholine. They are called cholinergic agonists, or they are called cholinomimetics. They are called cholinomimetics. Now, these drugs are classified as have various classifications depending on the pharmacologically and also mode of action. So pharmacologically, they have a three spectrum of action, and that is muscarinic agonist. Examples of muscarinic agonist are beta-narco, metacholinergic, and pyrocopamine. And the nicotinic agonist are nicotinine. Both muscarinic and nicotinic agonist, that is acetylcholine and carbamazepine, that is pharmacologically classifications. They can either be muscarinic, they can either be nicotinic agonist, or they can be either be both. So mode of action can be either direct acting or indirect acting. Indirect acting, they bind directly to and activate the muscarinic or nicotinic receptors. Indirectly acting, they act by inhibiting the hydrolysis of endogenous acetylcholine. So direct acting also is divided into other divisions chemically, and that is esters of chlorines. Example, acetylcholine, beta-acetylcholine, methyl-choline, and carbocholine. Then we have acroins, just as muscarine and pyrocopamine and nicotinine. So indirect classifications in terms of mode of actions, we have these ones works by inhibiting the hydrolysis of endogenous acetylcholine, and which is again divided into two divisions, that is reversible and irreversible. So reversible is, for example, neostigmine, pyrostigmine, and pyridoxystigamine, abemonamium, and androponium, and donespanyl, garatamine, and investamine, and tactirine. Then irreversible are the ecodiopine and esoflupapine. Those are the irreversible types of sulforaphane. Now you can see that the way they work is that they work at the point of reducing acetylcholine points. They work on the negative perspective of this one, where they have the agonized. So indirect and direct, sometimes quaternary cholesterol inhibitors also have a amount of modest direct action as well. Examples is neostigmine, which activate neuromuscular nicotinic cholinesterase beta directly additional to blocking of cholinesterase. So these drugs, cholinereceptor stimulants, they work by either in the nerves, in the gland and endothelios, and also heart and smooth muscles. These were where the receptors, you will see the receptor. These were the receptors of these cholinergics, acetylcholine is, and which these ones works on the muscarine, and the muscarine either in the nerves, in the heart muscles, or on grand endocrine works on the muscarine. Again, on the other side, it can work directly acting on drugs like cholinase, esters, and acroins, which can work again on the muscarine receptors and the nicotinine receptors, again, which can work on neuromuscular end plate skeletal muscles or autonomic ganglion cell. On the other side, it can be either reversible, that is directly acting and increases acetylcholine, which can act on the muscarine and nicotinine effect, which can be either reversible or irreversible. So the basic pharmacological of these direct acting acetylcholine agonist is that all the direct acting cholinergic drugs have longer duration of action than acetylcholine, the natural occurring itself. So choline esters are poorly absorbed and poorly distributed in the central nervous system because they are hydrophobic. So the tertiary cholinomimetic alkaloids, that is pyrrolidine and the nicotinamide and the aloperidine, are well absorbed from both sides of administration, or are anhydrous in the GIT and rest active by the oral route. They differ markedly in their susceptible to hydrolysis by cholinesis, this, which is a enzyme. So acetylcholine is very rapidly hydrolyzed and methacholine 3 times more resistant to hydrolysis. Carboxyl and metanoxyl are extremely resistant to hydrolysis. So pharmacologically, you can see these ones agonists like acetylcholine. It is highly degraded by cholinesterase, so it does not stay long in body. So it acts on masculine modality and also nicotinic activity modality, but it highly antagonizes atropine. So it highly antagonizes atropine. Then methacholine is slightly degraded by cholinesterase enzyme. It moderately works on masculine effect and also nicotinic activity pathway, and then it is highly antagonist of both atropine. Then carboxyl choline is never degraded. Then it has highly nicotic pathways and lead through effect on atropine antagonist. Then we have beta which has no effect on this, but highly sensitive to masculine effect and highly atropine antagonist. Then we have muscarine, which has highly masculine activities and atropine antagonist. And then you have ferrocapine, which has masculine activity, highly, and then atropine antagonist. So when you are selecting these drugs, you have to check on these factors so that you know where it's going to take, and also when you are going to do about atropine, teicozonin, as an antidote, you check on these factors. So acetylcholine, although it is a very most system in the body has this one, but it does not have any therapeutic effect because it has so many actions in the body, so it is not very specific. For example, and it is highly degraded by the enzyme of cholestasis, so it does not stay longer in the body. So in the GI, in the cardiovascular system, it reduces the heart rate, conductivity of the heart, and also blood pressure. So it lowers the blood pressure. The GIT, it increases the GIT motility and the GIT and the blood. In the pulmonary system, it increases secretions on the bronchus, so it can cause obstruction of the airways. In the eyes, it can cause meiosis and accommodation. In peripheral nervous system, it causes contraction of skeletal muscles, and in the central nervous system, it affects the neurotransmission at the ganglion level, and then neurotransmission. Then endocrine system, it causes the release of epinephrine, and from the adrenal medulla, now like epinephrine receptors, and in the sweat glands, it stimulates the sweat glands excretion. So a response mediated by muscarinic receptors is like in the heart, the atrium, they cause reduced heart rate. In the anteroventricular node, it causes reduced conduction. So this one can cause heart block, can cause a heart block, Then in the eyes, it can cause a contraction of sphincter muscles of the iris and the ciliary contraction, so they can cause. Then in the gastrointestinal system, it can cause increased tone, motility, and excretions. In the renal system, it can cause a relaxation of the sphincter, and in the secretory glands, it can increase excretions. That means it can cause increased twisting, it can increase mucus secretion in the respiratory system, and also glands of the saliva. So response mediated by nicotine receptors is that it works on the autonomic ganglia, depolarization and renal medullary excretion of epinephrine, and also neuromuscular junctions, depolarization of motor end plate. So, adverse effect of this is because excessive generalized cholinergic stimulation like diarrhea, increased blood pressure, urination, meiosis, bronchoconstrictions, like accumulation and excitation of the striatal muscles and salivation of sweating. So, the other type of drug is beta cell. It has duration of action of about 1 hour. It means action on the smooth muscles is on the brander GIT, causing increased intestinal motility and tone. Betanol stimulation the bladder and bowel. That is the BBB. It stimulates the bladder and the bowels, and also therapeutic use. It is used in a tonic bladder or in postoperative and obstructive urinary retention. So it is good for a tonic bladder. So another one is carboxyl synthetic profound effect on both CNS, cardiovascular system, and GIT because of its ganglion and neuroadrenaline receptors stimulating activities, and they may be fast stimulate the integration of these systems. So carboconyl can cause epinephrine from the adrenal gland to be released by its nicotinic action. So it is tuned in the highest causing meiosis and spasm accommodation, and rarely used in therapeutic except in the high to treat glaucoma because of its high potency and relatively long duration of action. Another drug is bedacorin, which act on muscarinic receptors used in diagnosis of asthma and bronchial hypersensitivity. So the other drug is pyrocapine, which is alkaloid in nature. It's a tertiary amine, and it is a stable and raised by acetylcholine. It is far less potent compared with the acetylcholine and its derivatives. There's pyrocapine masculine activities. There's masculine activity, and it is used primarily in the ophthalmic management, topical product and rapid meiosis and contraction and the ciliary muscles. Can cause spasm and accommodation of the eyes. The vision is fixed at some particular distance, making it impossible to focus. So pyrocapine is one of the most potent stimulator of the excretion, such as sweating. It can cause sweating, it can cause tears, saliva, and also can cause increased central nervous system disturbance when people use these drugs most of the time. So it stimulates profound sweating and saliva when you take this drug. It is going to stimulate sweating and adverse effect of this drug. So there is a condition called Sjogren's syndrome, and these drugs are used in treatment of this condition. It's a condition which is is an immunological disorder which causes the destruction of the exocrine glands, leading to the mucosal dryness. Patient manifest with dry mouth and lack of tears. It is usually treated with Savimeli. But there are so many drawbacks because it's not specific. So the recent study shows that it's good to spray the mouth with pyrocapine can work better in this type of patients. So therapeutic use of this is that it's a drug of choice in the treatment of the rolling of increased intracranial pressure in both narrow and angular and wide angular glaucoma. So let us look at some of the organ system affected by cholinergic agonist. So you will see that the eyes, the sphincter of the eyes are affected because they have masculine AM3, and because the response is contraction, which causes meiosis. In the ciliary muscles of the heart, it causes contraction leading to accommodation for nerve fusion. And in the heart, it acts using the receptor of masculine 2, and it worked on the senior atrial node, which can reduce the heart rate. Negatively, inotropic effect can reduce the heart rate. So in the atrioventricular, so it is good to give if you want to treat tachycardia, you can use it, but on the other side, it reduces the conduction in the atrioventricular node, because of M2 muscles leading to negative chronotropy, and this one can cause heart block. Heart block. So lungs, it can cause bronchioles, M3, that it can cause bronchospasm, it can cause GIT disturbances like stomach, gas, intestinal, it can increase grounds and diarrhea, involuntary infection, defecation, and then branda, it can cause contraction, relaxation, and the avoid and delay continence, and the spectrum, it can cause relaxation and except the raw esophageal which contracts, other ones they relax. So in the grounds, it can cause excretion, sweating, can be increased at starvation and evacuation. And in the blood vessels, it can cause dilatation, and endothelium, and endothelium. So sometimes it can also affect the intestinal pathway of inflammation. So that is how these ones and drugs works. So indirect acting cholinomimetics, how do they work? By inhibiting acetylcholine, protect acetylcholine from hydrolysis. So their pharmacodynamics properties are almost identical. Their chief difference between members of the group are chemical and pharmacokinetics. So the chemistry is that simple how comparing quaternary ammonium group, e.g., entroponium, carboxylic acid ester of alkyl-bearing and quaternary ammonium group, neostigamine, and tertiary ammonium group of physiostigamine. Organic derivatives of phosphoric acid, organophosphates, e.g., ecotherapate, are examples in these indirect acting cholinomimetic types of drugs. So, cholinesterase inhibitors, reversible like carbamides, alkaline organophosphate used in organophosphate and physiostigamine, tactile like Defros, ecotropin drug, neostigamine like parathion, insecticides. Pyridoxine uses diazonone. Diazonone is weapon and they cause irreversible binding convalent to cholinesterase types of anemia. So those are the type of drug. You can see that they are used in what we call what is called warfare. So the irreversible cholinesterase inhibitors only phosphate inhibitors push the bite covalently to acetylcholine and can permanently inactivate the enzyme. The effect of organophosphate can last as long as week, which is approximately time needed to synthesize a new molecule of acetylcholine. Is it all possible to reverse the effect of organophosphate? In most cases, no. However, if pluralism one this reactivity is given before a process called aging. Aging is the organophosphate binding of acetyl and loses one of its alkyl group. Then it will make it possible to remove organophosphate poisoning acetyl. So this is the reason why so many people you have to work very fast when people take organophosphate. You have to respond very fast, and otherwise they can die very fast. So you have to work before it does aging, it binds. So a cell, and the uses one of its alkyl group, then it may be also to move the phosphate acetylcholine. So absorption, distribution, and metabolism. This is the pharmacodynamics. So synthesis, quaternary ammonium agent like endroponium, neostigamine, pyridoxine, absorption from the conjunctiva, skin, and lungs is predictable throughout. Distribution in the CNS is negligible. So naturally occurring tertiary amine like physostigamine is lipid soluble, is well absorbed from all sites and can be used topically in the eyes. It is distributed in the CNS and it is not toxic. The organophosphate cholinesterase inhibitors are all absorbed from the skin, lung, gut, and conjunctiva, except for ecotherapate, therefore dangerous to human and highly effective insecticides. The hospitals like Malathion are quite lipid soluble, rapidly absorbed by all. They must be activated in the body by conversion to the oxygen analog and processed that occur rapidly in both insect and vertebrates. Malarone and a few other organophosphate insecticides are rapidly metabolized, detoxified to inactivate product in the birds and mammals, but not in insect. And unfortunately, fish, these and fish, these agents are therefore considered safe enough for sale to the general public. Malarone is not detoxified effectively in the vertebrate, thus it is considered more dangerous than malaria to human and livestock, and it is not available for general public use. The action of acetyl on the CNS, low doses can causes CNS activation. High doses can cause coma and respiratory arrest. In the eyes and the respiratory tract system and the GIT urinary system, the same muscarinic agent can occur. In cardiovascular, it can cause bradycardia, reduced contraction, and reduced coronary COP. Also can cause blood vessels effect on the blood vessels. In the neuromusculoskeletal injections, it can low doses can cause increased contraction of in high doses musculovasculation and the depolarization blockage can happen. Acetyl choline adverse effect is excessive cholinergic stimulation, and the treatment of acetyl poisoning is you give atropine, which reverses the muscarinic but not the nicotinic effect. So the treatment again, you can use blah, redoxamine as another treatment of choice. So the major therapeutic uses for the cholinomimetics is that they are used in eyes in treatment of glaucoma, in treatment of accommodation problems for short-sightedness in the eyes, and they are also used in gastrointestinal and urinary system conditions like postoperative atony, neurogenic branda. They are also used in the neuromuscular junctions like myasthenia gravis, current-induced neuromusculation, and B. You have to know that these inhibitors, not direct acting as therapeutic receptor agonists, are extremely valuable as the therapy of mesteniasis. So the drug used in mesteniasis gravis is that the diagnosis used to diagnose using entroponium in IV and duration of action of 5 to 15 minutes. And the treatment you use neostigmine, you use pyridoxystigamine and abenomium. You can see that the ammonium takes one time, that is, duration of action is 4 to 8 hours. So it is a good drug. But if you want to act it very fast, use neostigmine to act it very fast. So summary of the actions of cholinergics and agonist drugs is that choline is that they are used in treatment of renal retention and binding preferably of antimuscarinic receptors. You see that physioglycine increases intestinal and bladder motility, reverse CNS and cardiac effect of this tricyclic antidepressant, and the reverse CNS effect of atropine. It is unchanged tertiary amine that can penetrate the CNS. Then on the other side, you can see that rivastigamine and galantamine and dopizonide is used as part-time treatment of Alzheimer's diseases, though confers a moderate benefit. They have not been shown to reduce elderly care cost on delay of institutionalization, and also can be used in romantic. Carbaco cell is produces meiosis in ocular surgery used in topically to reduce intraocular pressure in open angle or narrow angle glaucoma, particularly in patients who have become tolerant to pirocarpine. Neostigmine can prevent postoperative abdominal distension and urinary retention, used in treatment of myasthenia gravis and used as an antidote for competitive neuromuscular blockers. It has intermediate duration of action, which is 0 to half an hour to 2 hours. The other one is ecodiopin, which is used in treatment of open angle glaucoma and has long duration of action of 100 hours. So it can take too long. That is around almost 5 days. Oh, no. So pirocarpine reduces intraocular pressure in open angle and the narrow angle glaucoma and binds preferably at muscarinic receptors and chase tertiary amine at, and that can penetrate the central nervous system. And then androponium used for diagnosis of myasthenia gravis, used as an antidote for competitive neuromuscular blockers, and has a sort of duration of action of 10 to 20 minutes. Acetylcholine used to produce meiosis in ophthalmic surgery. So basically, that is summary of this discussion about the acetylcholine agonist type of drugs, and they are very important for us. Thank you very much for listening to this lecture.